My name is Marc Darrow. I practice Prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do Prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of Prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains Prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com.
This will be my fourth session.
Okay.
I've been here for a whole month now. I had a problem with my hip and my knee, and also my back. He's just starting to work on the back. But I was told that it was time for me to begin looking for a surgeon.
So here we have a 78-year-old gentleman who was complaining of 4 years of right groin pain. When he came in, we did an x-ray and found that he had arthritis in the hip, and we immediately started Prolotherapy. And as you can see here, we're going to inject right where that joint is. The hip joint is in a strange place, you might think, because the femur or the thigh bone comes straight up the leg, and then it kind of juts into what we call the acetabulum, or part of the femur, and the bones join at that point. So we're injecting right into that area, as you can see here. It's fairly painless because the skin we break through fairly quickly, and the rest of the tissue has very little in the way of pain fibers. Now I've had the patient turn on his left side, so we could also inject the lateral side of the hip joint, which I'll be doing right now. And again, this is fairly painless. The patient takes this very well without any complaints. In that the hip is a very large joint, it heals slower than some of the other joints in the body, and we counsel patients that they have to be patient. Now, we typically inject once per week, which is unlike most prolotherapists, because we feel that this has the quickest healing response.
Really see a difference during the week after everything is worn off. I can see that I can move this hip much more easily than I did before, and I just have very good feelings about it. Prolotherapy is basically painless, and there's almost no recovery time.